Good. Let that hip roll now. Good. Breath in and out.
Whoa.
Good. Breath in. Let it all the way out. Good. Good. Welcome back, everybody, to the saga that is Kaylee's low back. We're gonna piggyback a little bit on a video that you probably have already seen where her and Dr. Alec works together in managing her psoas, her deep hip flexor dysfunction.
Yeah.
And we're gonna help address kind of primary, secondary, sort of a runoff of a lot of issues like that. So we all know that Kaylee has a low back that's been very unhappy with her for a long while. Like Dr. Alec addressed in his video, is that Kaylee's lumbar spine, her facet joints, are very coronally oriented. That means she can live a lot in rotation of the lumbar spine, but when it comes to flexion and extension, she has a lot of irritation, which is very classic, especially extension stuff is classic of lumbar facet syndrome. And that's what we're gonna address on Kaylee today, is her issues with the facet syndrome in her low back. So,
My issues.
well, you do have them. What she's been reporting yesterday for sure, today as well, is that you've been having pain radiating where, Kaylee?
Down my glute.
Down her glute.
It was more left yesterday, but now it's more right, which is how it's usually been in the past.
Okay. So it's very common to see that sort of referral of pain when it comes to facet irritation. Hangs out in the glute. Rarely will it go past the glute. When you start to see stuff farther into the hamstrings, past the knee, stuff like that, then you're starting to kind of dance with maybe a lumbar disc, potentially depending on the exam. But lumbar facet syndrome loves to hang out in the low back and the glute portion. So let's run through a quick exam. Let's kind of show the peeps how well you move, how well you don't move, and what really gets you going. Okay? So what I want you to do first, stand right there, perfect.
Wait.
Empty out your pockets, all right, you good?
Yeah.
Okay. I want you to take a slow bend forward towards your toes. Although Kaylee has a great range of motion with flexion and extension,
Yeah.
she's a very mobile lady.
Can feel it in my butt.
But she felt it more in her butt when she bent forward. Let me give you support here. I want you to bend backwards, full range. Yeah, so she's got a lot of extension too. How'd that feel?
More in the back, like here.
More in the back, okay.
Yeah. Extension yesterday was not my friend.
And that's one of the reasons why she would not respond well with the McKinsey protocol, is because that forces her in a lot of extension, and extension is something that she does not want. No, let's see,
It's not like.
keep the shoulders and chest upright. I want you to slide the hand down your leg each side here. How does that feel closing down that right side?
Fine.
Feels fine? Okay.
Yeah.
Now go back the other way.
I feel like this side's harder.
In what sense?
Like it feels tighter. Like I feel looser though in this way.
Okay.
But like this way.
So when you
I
go
feel
left,
it
where do
feels
you feel the most tension? On the
Her.
opposite side, the right side. Okay.
Yep.
So,
This side I don't feel it as much. Pain wise.
sure, I gotcha. So go back again for me. Now let me roll this shoulder back, a little compression.
I didn't like that. But it's fine.
Yeah, good. So go back again. Let it roll, compression. Which side was worse?
They're kind of the same, but I would say a little bit more on the right side.
More so on the right. So essentially what I just did was I put her into a maximal compression position of her facet joints. So extension with rotation to that side is maximally closing down the facet joints, and that's gonna light her up like a Christmas tree if she has facet irritation.
I didn't like that very much.
Not much. So what we're gonna do with Kaylee is, obviously we're gonna adjust, but management for this sort of issue is we're gonna dry needle, because the muscles surrounding these joints start to get really stiff and locked up because movement right now is causing her some pain. So her body's trying to protect her because movement's causing pain. Your body's like, okay, let's not move then. So it tightens up a little bit, and that's where a lot of that tension feels or sensation she reports when she starts to move. So dry needling to help soften up those muscles. We're gonna follow it up with class 4 laser. Laser's good at helping. Do what, Kaylee? You've done it long enough.
Oh my God. I don't know. Don't put me on the spot like that. I don't. Don't put me on the spot like that. I get nervy.
It's nervous. So class 4 laser is gonna help kind of with pain modulation. It's gonna help the sensation of pain subside, as well as give mitochondria, which is
Paralysis cell.
yes. It's gonna interact with mitochondria, help produce ATP, which is needed to help with, cellular metabolism. It's gonna help the healing process, help the tissue feel better, and massage all at the same time. Cool. Dry needle, laser, adjustment. Sound good, Kaylee?
Uh-huh.
Cool. Let's get you adjusted.
Face.
On your stomach first. Oh wait, no. I read your comments, guys. Face paper is a sin. All right, go on your stomach.
Oh my God.
One of those buns will work.
Do I keep the microphone? Whatever.
I would say yes. Just don't breathe in it, please. Because no one wants to hear that.
Okay. I'll try my best.
Cool. So I'm going to open up her T-spine a little bit more, get some mobility through there before we really start to rotate her and get the low back in the hips. So right now, she is not as mobile through her left SI joint. Kaylee, why do you think that is?
I don't know. Walking.
Walking? I don't think. Good. Okay. Breath in. And out. Good. Do another breath. Good. Let it all the way. Good. Alrighty, Kaylee, I want you to roll and lay on the left side of your body first. There you go.
I had to think.
I'm always impressed with how many patients I interact with that have to do this.
Just another one
Probably
of your
at
little
least
tallies.
70% of patients I do have to do this. How'd you pass your driving test?
That's easy because you got like the clicker to show you where you're going, which side.
Sure.
Anyways.
I also found out that up until a few years ago, they're not making people parallel park to pass a driving ed test, which is crazy. That's insane. Good. Let that hip roll now. Good. Breath in and out.
Whoa.
Good. Other side. So what I'm doing with Kaylee right now is
Fall off the table.
I find it easier for someone that's very flexible or someone who has a higher hip width to bring their leg out straight and sort of support it between mine. Really helps kind of roll that pelvis. And then what I'm doing with the thoracic piece is I'm allowing her to go into a little bit more lateral bending when I do the adjustment.
Yeah.
For her, she responds a lot easier to adjusting like this versus really kind of cramming you and rotating you and twisting you.
Yeah.
Yeah. Cool. Breath in. Let it all the way out. Good. Good. On your back.
I feel like I'm gonna fall off the table that way.
All right, Kaylee. We're gonna do dry needling next. And then
Love to see it.
you get laser.
I get laser. I never do laser on myself.
All right, guys. We'll see you in just a second for dry needling. So Kaylee is extremely locked up in her QL right here on the right. And that kind of bleeds into her erectors. Left side's a little bit more squishier.
Which is
Not
weird.
as much tonicity.
Usually my left side's worse.
But her left QL still has quite a bit. Okay, I'm gonna start right first.
Okay. Yo.
So, with the ones I'm doing here first, we're really looking at the lumbar erectors. So, finding her spinal process, going about 1 body inch laterally to that, to the meat of the muscle.
Ew. That's just nasty how you describe that.
And then find her 12th rib. Find the top for iliac crest. You're gonna feel a nice little band of tissue. That's where your QL sits. Even more laterally to your spinal erectors.
Ew.
That was a good one.
Yeah.
And we're just gonna mirror that on the left side here. Kaylee, what does dry needling feel like to you? What's the sensation you get when you get dry needled?
This is hard question. I always say it's like kind of like deep pressure. Like
Sure, you
someone
say
just-
that, but what does it feel like to you?
To me?
Yeah, to you.
Oh my gosh. Well, like the initial little zink of a needle kind of feels like a pinch.
Okay.
But then like when it's going in, it just feels like a weird, I don't even know how to describe it. Like a deep pressury, someone is pushing on you like really, really hard.
Okay.
And then when you stop moving it, I don't feel it anymore. But sometimes they're worse. And that one's more like a sharp, deep pressure. Like that one was a little zingy. Like a little sparky little thing.
With tissue that's not as tonic, you'll get that report of a deep pressure or like someone's really pushing in with their thumb on you through that tissue.
Yeah.
Through areas with a little bit more active trigger points that are kind of hypoxic, you get more of a sharp grab or a muscle twitch.
Yeah.
That's what we're looking for. We're looking to stimulate some blood flow to those trigger points and kind of help break them apart. How you doing with those?
Rocking with them.
You good with them?
Yeah.
Cool.